Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our cancer awareness series, we have Dr. Anil Kumar with us. Dr. Anil Kumar is a medical oncologist in Bangalore and is currently practicing in Sparsh Hospital. For the past 10 years, he has worked as an oncologist. Welcome to Medicircle, Dr. Anil Kumar.
Thank you.
So, India ranks among the thirds in the terms of the highest number of cancer patients. There are over 13 lakh people who suffer in India from cancer, according to the National Cancer Registry Program report. So, Dr. Anil, can you please tell us that what are the 5 risk factors for cancer?
What are the risk factors being diet, lifestyle, habits, and genetics? Diet is what we eat every day, right? Everybody is telling organic farming, they avoid pesticides, eat healthy food, stop drinking aerated drinks, right? Have a healthy diet. Don't go for eat burger, sandwich, which are high in fat. So these over long run, diet plays a very important role why somebody develops cancer. And second thing is lifestyle. Lifestyle is type A personality, stressful personality, obesity, not exercising, and your occupation also becomes a lifestyle. Sometimes people working in cotton industries, cement factories, people working in chemical industries. Okay, so all these are lifestyle. Then coming, the next one is habits. Habits is of course smoking, alcohol, tobacco, gutka, tobacco in any form. So all these things, diet, lifestyle, and habits over long run, would say over 10, 20 years would dictate why an individual is going to develop some particular. So leaving apart, there's something called genetics, where we see young women with breast cancer. So that is there's nothing wrong in all these three, but there's the inheritance of a defective genes from their ancestors. So because of which young people develop cancer. So that is another one. Fourth one is genetics. So basically, diet, lifestyle, habit, and genetics predict why an individual is going to develop cancer. And also screening. As the age increases, your risk of developing cancer increases. So at that particular age, there are a couple of screening tests which will help an individual know that his risk of developing or his cancer risk is high. Like I'll tell in my subsequent questions, what are the cancers where screening has been done. Since in India, we don't have a uniform screening policies, so we don't pick up these cancers early and we tend to come to a diagnosis late in advanced stages.
Yeah. So, doctor, can blood tests detect cancer?
Blood test?
Yes.
There are high-end tests which are being done right now, which would, predict how an individual is going to develop cancer. Although it's in very early stages, in the research stages, maybe in near future we get to know by a blood test we can predict the risk of cancer.
So, doctor, can you please tell us that what is stage 1 cancer?
Stage 1 cancer, for example, if you say breast cancer, stage 1 is when the tumor is confined only to the breast tissue. That is, it is within the breast. Stage 2 is when the cancer has gone from breast to the armpit. So that becomes stage 2. Stage 3 is it has spread from breast to the armpit. Then from the armpit, it has gone to the neck lymph nodes or to other lymph nodes in the body. Then it becomes stage 3. Stage 4 is, of course, distant metastasis, which becomes incurable. It has gone to the bones, it has gone to the liver, it has gone to the brain. All this is stage 4.
So, doctor, can a person survive stage 5 cancer?
Yes. So sometimes not all stage 4 cancers are not incurable or will lead to death. So stage 4 cancers also, with treatment, we could, increase their lifespan. Of course, we also have to look at their quality of life. So based on each particular cancer, it's very difficult to make a common statement here. So as per each individual cancer, the response and the survival will depend, even though it's stage 4.
Okay, doctor. So, according to the Indian Council of Medical Research, it is estimated that there will be a almost 12% rise in the cancer cases in India by the next coming 5 years. And the most common forms of cancer would be the breast cancer, cervical cancer, and oral cancer. So, as cancer cases are increasing, how often should we go for the diagnosis test?
Yes, what ICMR has told is true. In men, it is going to be tobacco-related cancer, which is on the rise. In women coming from urban India, it is going to be breast cancer.
Yes.
Women coming from rural India, it is going to be cervical cancer. So for cervical cancer, there is a vaccine which is available, human papilloma virus vaccine, Cervarix and Gardasil, which are in the market. So teenage girls can themselves with the vaccine. Even boys, there is no harm. So that vaccine is available. Now an Indian version of the vaccine will come with a different price range. So that is also will be available shortly, which is much cost effective.
Yes.
And coming to detect cancer in early stages, for cervical cancer, we have to do pap smear. Women, as soon as they begin sexual intercourse or after marriage, once a year they have to undergo pap smear compulsorily for 3 consecutive years. Then after that, they slow down, they do once in 3 years. So by doing this, we pick up cervical cancer when it is in stage 1 stage only. So in stage 1 stage, if you pick up cervical cancer, just a simple procedure can, stop the cancer there. So you don't need advanced modalities of treatment for cancer like chemotherapy, surgery, radiotherapy. All these things can be avoided. So this is about cervical cancer. For breast cancer, women after the age of 45 years, once in a year, they have to undergo mammogram of both the breast. Mammogram is a simple X-ray we do. So this they do once a year for consecutively for next 15 years. That is up to the age of 60 years. By doing this, you can pick up cancer in a very early stages. That is, maybe you could pick up in stage 1 or even sometimes even earlier to that also you can pick up breast cancers early. And the next cancer is colon cancer, the large intestinal cancer. Men and women after the age of 50 years, once in 5 years, they have to undergo colonoscopy every 5 years. That is, they put a scope from below with a camera and see for any polyps or anything abnormal in the colon. So once in 5 years for next 15 years, that is up to the age of 65 years. So by doing this, you can also pick up colon cancer early. So worldwide, these 3 screening methodologies, that is pap smear for cervical cancer, mammogram for breast cancer, and colonoscopy for colon cancer, by doing which you can detect and treat these cancers early. But unfortunately, in India, we don't follow any strict protocol or rules to undergo these screening tests, right? So that's why people end up coming late or in advanced stages, because we don't pick up them in early stages.
Okay, doctor. So on Medicircle, our main focus have always been to provide information to our viewers in less time. And so today we will be conducting a short question answer session for which you can answer either in 1 or 2 lines or in yes or no also. So my first question is, doctor, that do depression lead to cancer?
There is no direct evidence that depression leads to cancer. But of course, if you are depressed, you are type A personality, you don't exercise, you are a couch potato, your diet is hampered, your sleep is altered. So in an indirect way, your diet, lifestyle and habits are affected if you are depressed. So that in turn, over long run, can, impact your cancer.
So doctor, does workout helps in cancer treatment?
Definitely, workout helps in cancer treatment. The tiredness is there after chemotherapy, so you get out of the tiredness. You try to work out in whichever possible way which your body allows. So by doing which your immunity levels are higher and your appetite is good. So when people are on chemotherapy, their appetite is also reduced. They don't have taste. So by doing workouts, you could mitigate these side effects of chemotherapy.
Okay, doctor. So many of the patients are concerned whether chemotherapy is painful or not.
Chemotherapy per se is not painful. The side effects of chemotherapy are very common. Hair loss is very common, gastritis is very common, loss of taste is very common, and sometimes mouth ulcers, loose motions, weakness, tiredness. These are very common side effects, but these are part and parcel of treatment. So the cancer cells, when they are being killed by chemotherapy, at the same time, the normal cells are also being killed by the same chemotherapy. So there's no need to get scared when you are on chemotherapy. You have to be brave and face the situation. And once you are through your chemotherapy schedule, then you are ready to lead a normal life.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show. Thank you so much.
Thank you very much.